How to decrease libido. Your libido is also commonly referred to as your sex drive. It's your emotional and mental desire for sex. Your libido is individual to you and varies widely between people. What you experience as normal libido might be higher or lower than what somebody else experiences. A number of factors influence your libido, such as age, hormone levels, stress levels, changes in your sexual relationships, fatigue, illness, medications, your personal beliefs and attitudes toward sex. Some people worry that their libido is too high. A high libido is generally not a concern unless it's having a negative impact on your life or relationships. If your high libido is disrupting your life or results in sexual activity that feels out of your control, it may be a sign of hypersexuality or what has traditionally been referred to as sex addiction. How does your libido work? First, it's important to know exactly what your libido is. It's simply a term for your desire for sexual activity. Once you engage in sexual activity, your body goes through arousal, physical changes to prepare for sex. Here's what happens to your genitals during this stage. If you have a penis, you'll generally experience an erection as blood flows into tissues in the penis. If you have a vulva, the vagina will often experience an increased production of vaginal fluids and swelling of the vulva and clitoris from increased blood flow. Like other animals, humans need to have sex to have children. Our sex drive is deeply rooted in our biology as a way to encourage us to reproduce. Your libido is individual to you, ranging anywhere from having no desire in sex to thinking about it frequently. But unless your sex drive is causing problems with your relationships or in your life, it's essentially normal. Biological, psychological, and social factors all play a role in determining your libido, including biological factors such as your levels of testosterone or estrogen, overall health, and presence of illness. Psychological factors such as stress, presence of mental conditions like depression, and your self-esteem. Social factors such as the health of your current sexual relationships and the norms around your ability to act on sexual desire when you're in a situation where you feel aroused. How can I decrease my libido? If you feel that your libido is too high and having a negative impact on your life, here are a few ways you might be able to manage it. Diet. Some research suggests that there are some dietary changes you can make that may have an effect on your libido. But many practical dietary changes you can make to lower your sex drive may compromise your overall health. Aphrodisiacs are foods or medications that increase your libido. Anaphrodisiacs are the opposite. They're foods or medications that lower your libido. Soy has also been claimed to lower libido in men by lowering testosterone. Psychotherapy. If your doctor doesn't suspect that your high libido has a physical cause, they may recommend that you seek therapy or counseling. Speaking with a therapist can help you uncover reasons that may be triggering your experience of high libido and help you learn techniques to manage it. Therapy sessions can come in many forms, including one-on-one, family, or group. It's up to you to decide what you're most comfortable with when it comes to discussing your sex drive. Work on your relationships. If you're currently in a relationship but not satisfied with your sex life, you may want to discuss this with your partner to come to a mutual consensus as to how sex can be fully satisfying for both of you. If you're not currently in a sexual relationship but would like to be transparent with your potential partners about your expectation in a sexual relationship and communicate openly about what you do and don't like. Stop illicit drug use. Cocaine and methamphetamines are two illicit drugs that can increase your sex drive, and reducing their use can help lower your sex drive. Quitting these types of drugs can be difficult by yourself, but there are a number of support groups and services available for you. When should I see a doctor? A high libido isn't an issue until it starts negatively impacting your life or relationships. Compulsive sexual behavior, sometimes called sex addiction or hypersexuality disorder, refers to sexual behavior that disrupts your life. Here are some signs that you may be experiencing compulsive sexual behavior. difficulty maintaining healthy relationships, engaging in sexual behaviors that negatively impact your life, excessively using sex or masturbation as an escape from stress or personal problems, reoccurring urges or fantasies that feel beyond your control, trying unsuccessfully to reduce your sexual urges, financial or legal problems, as well as other serious consequences that result from your sexual behavior. Your libido is another name for your sex drive. Your libido is individual to you, and what's normal for you may not be normal for somebody else. Generally, a high libido is only a concern if it's causing issues with your relationships or life. Talk to your partner, your doctor, or a counselor if your high libido is keeping you from having sex life you want.